Welcome to our Monday Minute. Today we're going to review the proposed changes to the wage index and CBSA classifications found in the home health proposed rule. There were many found in the hospice rule as well, some of them very similar to the ones in home health, but there are slight changes on occasion in the wage index results between home health and hospice. In the home health proposed rule, there are 53 counties that would be changing from urban to rural. Of those 53, 29 of them will have a significant reduction in wage index greater than 5%. 54 will be changing from rural to urban, and of those 54, 10 will actually see a reduction in wage index greater than the 5% cap. 88 counties will have some realignment of CBSA classification. In some cases, the counties will be moving from one wage index to another. In some cases, those counties will just be renamed, etc. But there will be changes to an additional 88 counties. Of those 88, 10 of those counties will see a reduction in wage index greater than the 5% cap. Of the total 195 counties that will have some type of CBSA realignment, 106 of those have a positive change in wage index, with 89 of them having a negative. There are 3,266 county CBSA codes, with 1,350 of them having a negative wage index impact for the coming year. For the ones that I mentioned that will have a reduction in wage index of greater than 5%, there was a 5% cap put on all wage index changes last year. That change was a permanent change, and therefore any reductions in wage index moving forward would be capped at 5% each year from what it was the prior year. In the case of a reduction to your wage index in excess of 5%, you will be issued a temporary CBSA code that will be utilized to bill claims until your wage index becomes equal to where it should be. Meaning, if you were supposed to have a 10% drop in wage index, then this coming year in 2025, your wage index reduction will be capped at 5% less than the wage index you have this year. Next year, 2026, you would have an additional 5% reduction lower than the change that already happened in 2025. So it could take you at 3 years to get to a point where your CBSA wage index has caught up with everyone else in your area. This is different. Before they made the cap maximum 5% per year, it was only 5% for the first year, and then if it was supposed to drop 12%, you had to absorb the additional 7% in the subsequent year. And so this at least staggers the implementation when there is excessive amounts of wage index to be applied. You will need to check the wage index tables found in the proposed and will also be found in the final update to the wage index. Those wage index transition codes, they are referred to, will begin with a 50. Again, that will be your CBSA code utilized for 2025 for sure. And then dependent on how big the reduction is to be for 2026, you may have to use it in that year as well. It's imperative that your billing team be informed if your county is one of the counties that will be subject to this reduction with the 50 CBSA code needed on your claims. In addition to your billing department being alerted, you will need to ensure that your EMR system has updated your CBSA code for 2025. Even if you are not subject to the 5% reduced cap and a temporary transition code, you will need to ensure that you have the appropriate CBSA code in your system. As I mentioned, there are 195 changes, with 88 of those being simply changes to the CBSA situation, and could mean simply a change in the CBSA code, even though you're not moving from urban to rural or rural to urban. I briefly mentioned 10 the counties in Connecticut earlier. Connecticut has had a revamping from what is referred to as planning regions to now county classifications. There are 10 of those counties, and each of those 10 counties will have a reduction in their wage index for 2025. Healthcare Provider Solutions is here to help you understand all aspects of the home health proposed rule. If you need any assistance in understanding these wage index changes, or any assistance with billing and collections at all, we are here to assist. I hope you have a fabulous week.